Hello?
Hi, Dr. Fulger. It's Susie Burnett.
Oh, hi, Paramedic Burnett. How are you?
I'm doing well. How are you doing?
Doing okay. What's up?
I wondered if I could pick your brain about the COVID vaccine, especially since EMS providers are able to get it soon.
Okay.
Um, so I was just thinking about it, and I know a couple of my friends have had COVID. So can they get the vaccine?
Absolutely. So the recommendations currently are that even if you've had COVID, any immunity that you get from actually having COVID may be limited. And it also might be limited more so than if you were to actually get the vaccine. So the recommendation at this point is that people who have had COVID still get the vaccine, but they are recommending a little bit of a delay between the time in which you were infected and the time in which you get the vaccine. The best information that I can give you right now is about 90 days from the time that you were initially infected. But as we learn more, as time goes on, those recommendations might change. So it's important to keep an eye on the most current information and also getting a hold of your own physician for some further guidance as well as time goes on.
Gotcha. Okay. But what about my friend who's pregnant right now? Can she get the vaccine?
So there's a lot of questions about people who are pregnant or people who are breastfeeding, and the current recommendations from the American College of Obstetrician and Gynecologists is that people who are pregnant and are breastfeeding should probably still get the vaccine if they're otherwise eligible to do so. And the reason being is because people, especially those who are pregnant, if they do get COVID, they are at increased risk for complications. And the risk of the vaccine at this point is considered to be less than actually getting COVID. So with anything that involves pregnancy or breastfeeding, it's always a good idea to talk to your obstetrician or your primary care. But at this point, the recommendations from that college are that pregnancy and breastfeeding should not prevent people from getting the COVID vaccine.
Okay, that's probably a good thing. Yeah, let me tell her that. I'm gonna make a note. Um, I also don't really like needles unless I'm using them. I don't really like to get injections or IVs or anything. And I heard there are two vaccinations. Do I have to get both of them, or can I just be brave enough for one?
Yeah, so I'm not a big fan of needles myself, actually, but you really do need to get two. You really don't get the protection that you need for long-term immunity after just the one vaccine. So unfortunately, I think that you're going to have to buck up and get both of them. But I'm sure you can do it.
I'm gonna have to get really brave. How long do I have to wait between them?
Depends on the particular vaccine. One of them recommends approximately 21 days. The other one recommends approximately 28 days. But you do have to make sure that you do give enough time in between both of the vaccines, but not too much time. And they do vary amongst the two different vaccines that are currently approved.
I see. Huh. What are other people doing? Do you know?
Well, a lot of the people that I'm talking to are getting the vaccine, and I think that's the most important thing. But if you do want some more information, I do know that hashtag EMS Vax is probably a good thing to look into.
Hmm. Okay. Well, that sounds cool. I'll look into that. Thanks, Dr. Floger.
You're welcome, Paramedic Burnett. Have a lovely day.
You too. Bye.
Bye bye.
There is no way to get COVID 19 from the vaccines. They do not contain the virus at all.
The side effects of the vaccine usually consist of pain at the injection site, some fatigue, headache, chills, or muscle pain, and generally last for no longer than about 24 hours. Those side effects are normal and indicate that the vaccine is working and that the body is developing the appropriate defenses to fight off the virus if and when it's exposed in the future.
Serious side effects, such as an allergic reaction to the vaccine, are rare and have occurred in less than 5% of those vaccinated. Each vaccine site is equipped and staffed with trained health professionals to respond to serious side effects or emergencies. Also, each person is observed for 15 to 30 minutes after vaccination to monitor for these events.
You won't test positive for COVID-19 after getting the vaccine because there is no active virus in the injection. The antigen tests help determine current infection.
People who already had COVID-19 should still be vaccinated because there is evidence that natural immunity, the kind one would get after contracting the virus, is not expected to last as long as immunity from the vaccine. You should check with your healthcare provider before your vaccination if you've had COVID-19 to determine how long you should wait after the infection before you get the vaccine.
If the timing of the vaccine's release seemed convenient, that's because all countries of the world needed a vaccine and poured money, resources, time, and expertise into doing this one thing. Remember, other countries received the vaccine at the same time, when they were ready and after they were proven safe and effective.
The current vaccines use messenger RNA. This means your cell's DNA won't actually be altered. The mRNA is used by your body to code for proteins that your immune system uses to defend against COVID-19. Once the mRNA has done its job, your body breaks it down and gets rid of it.
The current COVID-19 vaccines use mRNA, which means there are cells from people or other animals involved in their creation or administration. The mRNA is produced in a laboratory and is simply the instruction your cell needs to make its own protein.
Currently, there are 2 vaccines that have been tested on tens of thousands of people through various clinical trial phases. Both the Pfizer and Moderna vaccines received emergency use authorization by the FDA and support from independent scientists because they were demonstrated to be safe. Even though an emergency authorization was used, no steps in the development and evaluation of these vaccines was skipped.
Once vaccinated, you must still take COVID precautions. Wear a mask, wash your hands, and stay distanced. Although the vaccine will help to protect you, you may still be able to transmit the virus to others. Since our roles in the healthcare system help us to get protected earlier than most, we must still keep our loved ones, colleagues, patients, as well as strangers safe.
Hello,
Hey, Dr. Fulliger, it's Susie.
Paramedic Burnett. How are you again?
I'm doing wonderfully. Thank you for all of that information. And I went to hashtag EMS Vax and I saw that a lot of people in EMS are getting the vaccine. It seems like it's a good way for us to keep everybody safe. I mean, ourselves and our families and our patients. I think I'm going to do it. I'm really excited.
Good. I'm glad. Me too.
I can't wait to post my picture and show that I got a vaccine. And they give you a cool card so you can prove it.
Yes, the card is important. They give you a card after the first vaccine, and then then you need to take that card to your second vaccine so that they can give you a card after that in order to make sure that you can document that you have been completely vaccinated with both of the immunizations.
Well, I already went online and I made my appointment so I can get my first vaccination. So look for me at hashtag EMS Vax so that you can see that I have it with my cool card.
Sounds good. I look forward to seeing it.
Awesome. Thanks again for the information. I'm really grateful that you were willing to share some of your time.
Anytime. Have a lovely day.
You too. Stay safe.
Bye-bye.